she has done a little bit of work in Oregon as well as in Idaho. And she actually is one of our own apprentices, and she's been through our training program at Idaho State University. So if you have questions about that, she'd be a great person to ask today. And she has done a lot in healthcare gaps, getting patients to medical appointments, pharmacy. As you well know, if you're a CHW, kind of depends on what's up that day that you're going to be doing. But Jenni is incredible, and we'll be able to hear from her shortly. We also have Debbie Lehnert. Leonard, I always say it funny. Sorry, Debbie. You can correct me.
It's Lehnert. The H is kind
Leonard.
of
Okay.
sneaky. Yeah.
Leonard. Okay, thank you. And she is a community health worker supervisor, as well as a certified enrollment counselor with Full Circle Health. And she is very inspiring to talk to. I'm excited that we get to hear from her. She knows how to navigate that red tape. She knows how to catch chickens too, which we were just talking about if you joined back from the breakout rooms earlier about chickens. But she is also just very kind and rooted in justice and action. So you'll hear a little bit more from Debbie in just a moment as well. Then we have Jennifer. Jennifer is a recovery coach supervisor and certified drug and alcohol counselor. She has lots of different experience doing outreach and directing some different programs, and particularly for people experiencing homelessness, substance abuse, and mental health issues. As well as work with the Idaho Department of Corrections. Currently, she works at Alpine Alternatives as the director of the Safe and Sober Homes in the Twin Falls area, which is great work. And she'll share a little bit more about what she does there. She's also one of our fantastic instructors as well. If you've taken some of our classes, she may be one of your community health worker training a worker. Sorry, community health worker training program instructors. There it is. So, we've got James as well here as one of our guests. He is a community health EMS supervisor with St. Luke's Health System. And community EMS is a great place to be if you're looking at something with community health work and EMS, especially in rural areas. He's been doing things with the Bureau of Land Management, different EMS authorities across the states here. And then in Idaho, in different roles for Magic Valley Paramedics, St. Luke Health System, and I'll let them introduce themselves a little bit more as well. Then we have Liz. Last but not least, she is a disease intervention specialist in Southeastern Idaho, over here at our public health district. And with disease intervention specialist, she's been doing that for over a year, but also looks at things with a holistic approach. So that's our panel today. They all have different perspectives, and I'll just turn the time over to them in the order that I introduced them to talk for a few minutes about what they do, how it might relate to what our trainees are doing or our supporters are up to. So I'll turn the time over to starting with Jenni.
Good afternoon, everyone. Like I said, what I mean by being a community health worker my entire life, I've always helped people. Helping them with making doctor's appointments, filling out applications, coaching them through different life situations. That's what I mean by that. So a few years ago, when I was introduced to the role, the technical term, community health worker, I was like, there's training for this? Absolutely, let's roll with it. I did have a little bit of training with Oregon, but my time about a year ago, I started working with Weiser Memorial Hospital, and I came across the training with ISU. So, and I was able to jump like right into the advanced course, which I'm now listening to this morning. I'm glad I did because I didn't want to have to wait. gosh, that's great that you guys are able to train so many people. I am doing the apprenticeship right now. I started that in November. So yeah, I do a whole bunch of things. It just depends on the day. And the time. I take referrals from our 2 clinics in town. We have 2 different clinics. I get calls from our different agencies in town. Some of the employers in town will say, hey, I've got this employee that just is always late to work and I can't figure out why they're late to work. Will you come talk to them for me? We find out that it's an issue of they need a little bit of extra help filling out an application for Medicaid, and for that reason, and that it helps them. So I don't know, I feel like I just fill in gaps sometimes. So, and my role at the hospital just allows me to do that for certain people. So I don't know, I'm just grateful to be able to be a part of my community. I'm grateful that I am able to do all sorts of trainings to further my knowledge with in all different aspects, recognizing when somebody might be in distress or those sorts of things. I recently started a transportation program, which has been kind of exciting for our entire community. It's allowed me to help a patient up in Adams County, which is kind of my area, but not really, get to an appointment in Boise. I have 3 different options on my program. It's really been kind of scary, but kind of exciting because all of a sudden people are getting to their much needed appointments that they need to go to, where 6 months ago, people were struggling to do these things. I don't know. It's just I think it's an exciting profession to be in. I think something that's needed to be around for many, many years. There's probably people that you talk to daily that are already doing these things and don't realize it in different organizations. There's just a really big need to help people not be sick anymore. Just get their basic needs taken care of. We can help identify what their basic needs are. They're not going to be returns to the emergency rooms. There's so many things are going to be eliminated in their daily care, in their daily lives, and they can just live their lives.
Thanks so much, Jenni. And we're excited to have you on our panel today. And I forgot to mention this before I had you guys all start giving your little introductions, but we do have a Q&A format. So those of you that are participating, as you're listening to each of our panelists introduce a little bit about themselves, if you have a question cross your mind, feel free and drop it in the Q&A. And it can be a general question, or if you'd like it to be for a specific panelist, just note that. And then after they do their introductions, we'll facilitate a little bit of Q&A and discussion. So Ryan, is there anything you wanted to add?
Yeah, well, I do have a burning question for Jenni. And I'm gonna put her on the spot too. And so Jenni, and this is at some risk to us and to our training program, but you're clearly a lifelong learner. And we're interested in, we're in the business of upskilling community health workers, that term, to provide continuing education opportunities. So being that you have years of experience as a CHW, are you gaining anything from the apprenticeship?
I am, because there are portions of it and aspects of it that I wouldn't have done and I don't do, like the direct medical stuff. That's not stuff that I do. Like, I had a meeting with my boss the other day when I was actually logging stuff, and I'm like, we have to figure out a time between now and November that I do these things. Where can I do them? What part of the hospital? You know, where can I go to do these things? Because they're not something that's that aspect of my job. Like, so the I mean, if I have to administer first aid, I can administer first aid. But I'm the one that's gonna be like, I'm surrounded by doctors and nurses on a daily basis, so you guys do that. But if you need an application filled out, or you need me to talk you through a situation that you're not quite sure about, I'm your gal. The medical stuff, you know what I mean?
Yeah.
So
That's
I
helpful.
learn, I try to take something and learn every day. For example, I also have a patient, there was probably some self-neglect on his part, so we've stepped in. I helped with the Medicaid so we could get an A&D waiver. And I learned something from somebody at DHS yesterday on how to better fill out that application and bring it to the correct person's attention. So I try to learn something every day. Yes, I'm learning things on how to better do things. Yes, I'm learning.
I love that.
Great.
Always
Thank
learn.
you. Good feedback for us.
Yeah, you're welcome.
And I was going to say, Calton just put in the chat that the apprenticeship forces us to be aware of big picture things we're doing on a daily basis. And I think that's like when we put the competencies on the list from our perspective, I think that's what we hope to is you're doing these things, but then you're recognizing what you're doing. Because I think sometimes you get into a job and you're working it and you're doing it, but then you don't recognize all of the competencies that you gain or that you have that you're applying, right, Jenni? Like you said, that you're like, wow, I'm learning things always. So we appreciate that feedback for sure. So thanks. Thanks, Jenni.
Thank
I'm
you.
gonna take the spotlight from you here, and then I will turn the time over to Debbie. And at the end, or after we have each of the panelists introduce themselves, we'll have more open like questions, things like that. We have a few that were submitted beforehand as well that we'll get to. So, Debbie, I'll turn the time over to you. Go ahead.
Hi there. First off, thanks for having me. Sometimes I question a lot why I was even invited, but here we are. So, my name is Debbie. I am the Community Health Worker Supervisor with Full Circle Health. We're based out of Boise, but we do have 11 total locations that are everywhere from Boise, Meridian, Kuna, Nampa, Caldwell, just to name a few. We have a patient panel that varies right around the 34,000 patient mark. And we have an excessively large CHW program with 6 CHWs for all those patients. And I am really happy actually to see my team signed in on here. I see Diane, I see Trudy, I see Sam, I see Daisy, and I see Cece. So they, as a new supervisor, they have taught me so much, and they're still teaching me so much. And I am forever grateful for them. So with that being said, kind of going into the CHW skill set and leadership role. When I originally started here at Full Circle, I was actually a receptionist with zero experience, and especially in the medical field. And I felt like I really didn't have 2 skill sets to rub together in my own little brain. But somebody gave me a chance. So I started in reception. And within that first year, my own leadership actually called it out, and she said, "You need to be a CHW." And I said, "Absolutely not. There's no way, no how. I can't do that. I can't do that job. There's just I don't have it. I don't have it here. I don't have it here. I just absolutely not. I can't." I appreciate the compliment, but no thanks. And then over the course of a couple of years, you know, as my confidence grew in my own self, I kind of started to think, okay, wait a minute. I think I might be able to do this. So the brand new position came open. I was so excited, and I was going to apply, even told my boss I was going to apply, and then I completely chickened out and I didn't apply. And our director at the time, Luis Lagos, he came to me and kind of called me out on the carpet on it. So long story short, here I am as a CHW. And then I had the wonderful experience of being able to be under his mentorship for the better part of 2.5 years. And I can wholeheartedly say that I am the advocate that I am today because of Luis, for sure. So Luis, he moved with his family, so that opened up the position for leadership in the CHW program. And I applied, and here I am. So I still feel like I have really big shoes to fill when I look at Luis, but I'm, you know, doing my best. So with mentors in mind, that's kind of the first place where I wanted to, the direction that I wanted to point any CHW that is looking into being into leadership is get yourself a mentor. Somebody that you can look up to, glean from, but also to somebody that can really hold you accountable. Call you on your business, and gives you a safe place to struggle, because you're going to make mistakes and you're going to drop the ball. But you want somebody that can hold you to a respectful accountability. So get yourself a mentor. That's advice number one. My second piece of advice would be mental health and counseling. And I'm not just talking about our patients here. So your mental health is huge in any sort of advocacy role, but especially if you're going to take on a leadership role. So I know for our team, one of the requirements that we have is actually certification in mental health 101. And they offer that in just a general course, but they do also offer it through, they offer it for pediatrics as well. But that requirement is a big piece of what we ask our CHWs to do. And check in on your own mental health, right? Because we're only going to be so good for our patients if we're not taking care of our own head and our own heart. So the third piece is you got to know your specialties, right? I know I look at my team all the time and I think there's no way, like she just, Diane, prime example, that woman is a walking encyclopedia. And I still glean so much from her. You know, I've got Cece, she knows an insane amount about how to navigate health and welfare and Medicaid and disability. So know your strengths and your weaknesses, and mostly know your weaknesses, because then you can hone in and you're going to study that stuff like it's your full-time job. And there's so many resources out there, guys. If we look for ISU being one, they have the program that they have now. They also have, I think there's 30 some modules out there for free.
Yep.
That we can take right now. Another good program through Idaho State University is ECHO. They have a rolling catalog of webinars and things like that are constantly changing. Dig into that source, and then not just learning, but associations. So the National Association of Community Health Workers is an incredible resource for additional learning. Idaho has their own little Community Health Worker Association. So keep your eye out for those, because there's always learning opportunities. And if you ever think that you have just learned it all, check yourself, because it's not a reality, right? And then when you're doing those educations, get those certifications if you can. I think it just adds to your credibility when you are looking to either cross-train into a different role or possibly step into a leadership opportunity, because you're going to have that documentation, right? And unless you have something that is documented and you have data, all you have is your opinion, and we know what people can do with that, right? So your certifications, things like that. It's a great thing to just add to your list. The other huge piece that I think is big for leadership is your interdisciplinary work. So for us at Full Circle, that looks a lot like our work that we do with our providers, our residents, our MAs, our pharmacists, nutritionists, our receptionists. The more that you intertwine your work and your case management with those around you, the more you learn, first off, and they learn you. And that's when they can learn your work ethic and how you deal with your clients and how they can see you work professionally when you've got a provider or you have, you know, a stakeholder, whatever it might be. That's just gonna, it's just gonna add to your credibility. It's gonna add to your reputation too. And that's gonna come into the room way before you ever do. And ultimately, I have found, I think I have a prime example of it. At the end of the day, you can be the most educated and the most seasoned and the most veteran and the most, you can have the longest resume. You can have 1,800 different organizations and references, but if you are not someone that can be trusted to keep space in the trenches with the people that are alongside you, it's never going to work, ever. I don't want somebody's education to, you know, to sit in the ditch with me while I hold space with, you know, somebody who just lost their job, lost their housing, who's facing a mental health crisis, who is domestic violence, right? None of that's going to stand up when it comes to who you look to when you need something. So, and then also to my other biggest piece of advice is if you're even thinking about being a CHW or thinking about advocacy leadership, you already have everything you need inside of you that's going to make you great because you're thinking about it. It's there. And these are just a couple of different ways that has helped me build my own skill set. So hopefully that's a little helpful for you guys.
You're so awesome, Debbie. I want you as my mentor.
It wasn't me, I'm telling you.
I'm just teasing. So yeah, thank you so much, Debbie. And then I'm gonna turn the time over to Jennifer Cornie as well to take a couple of minutes and talk about what she does. And I just wanted to check before we move on though, can you guys see a Q&A spot to submit questions? I just want to make sure that that's available. Okay. Thank you so much. And don't forget that as you are going, if you have questions, you can pop them into the chat. So, or into that Q&A. Thanks. And let me remove this spotlight from Debbie here. And I'll put it on Jennifer, got all the J names. Jennifer, I'll turn the time over to you. Go ahead. You're muted, Jennifer. We can't hear you.
Gosh, okay.
There you go.
So that's hard to top. She did an awesome job. Anyway, I actually fell into the community health worker training or class. I broke my leg and it was the best broken leg I ever had because I was really bored. And I thought, oh, I'll take this class from Idaho State University. And guess what? It was just like the doors open, and it's just the most awesome job you can ever have as a community health worker. I actually work with BPA Health as a recovery coach trainer. And I'm actually right here in Moscow, Idaho right now, training recovery coaches. And they're kind of like also community health workers. They're going out there and using their lived experience to work with people with addiction. I also have Alpine Alternatives, and I work with women right out of incarceration. And so I've learned to be an advocate for these ladies that, you know, they get out and, you know, they're not on any medications, you know, the wrong medications, because a lot of you don't know that the state of Idaho, when somebody's incarcerated, sometimes they take them off medications that they're used to and put them on something else. And so when I get them, sometimes, they're not on the right medications. They've lost everything in their homes. They've lost, their children, they've lost all their clothing. Sometimes I get young ladies that, I've picked them up in boxer shorts from the jail and no bras and underwear, and they're starting from just ground zero. And so it's just like the best job you can ever have, just to help somebody, restart their lives and be there to listen, and advocate, but also using those skills, boundary skills that you have to have, and self-care so you don't get burned out in this position, because you can. Also, learning the different resources and the gaps in our systems. In our area, we didn't have any food boxes on Fridays, Saturdays, or Sundays. And so we actually talked to a couple churches and was like, hey, we really need this resource in our community. When these young ladies got out of jail, if they got out of prison or jail on Fridays, sometimes they didn't have any clothing at all. So we started our own clothing. We call it the clothing garage, and people donate clothing and shoes and so that they have something to wear until we can get them something. So sometimes we have to make our own resources. And so that's kind of a little tidbit of what I do. We're actually now training. I have quite a few young ladies that are, got their lives built up and they want to give back. And they're becoming recovery coaches, and so that they can help other people with their lived experiences. So I think I don't know if that sums
perfect.
it all up. So
Yeah, no, that's great introduction to what you're doing, and it's incredible work the more you learn about it too. So we appreciate you being here to talk to us about it. And we'll probably get some questions for you here in a minute. But we will turn the time over to James at this point to take a few minutes. Let's make sure you're spotlighted here for everybody. All
Oh,
right.
it's
Go
scary
ahead,
when
James.
it's scary when you're on the big screen. I don't know if I like this. So, my name is James Rhom. I'm the now manager of mobile integrated healthcare for St. Luke's Health System. That includes Magic Valley Paramedics, Air St. Luke's, in both Twin Falls and Boise and all over the place. First off, though, I'd like to say that I'm excited to be here because I am a proud fifth generation Idahoan from many small rural communities, and I'm a Bengal. So shout out to all the Bengals online. But anyways, so I oversee the community paramedics and community EMTs for St. Luke's, and I've been involved in this work for a long time. Oh, well, not for a long time, but for a while, since about 2013. And essentially what a community paramedic is a lot of these core competencies that you're accomplishing in the CHW courses. We are taking experienced paramedics and EMTs, and some of us understand that paramedics and EMTs are on ambulances and we're driving real fast to try to save people's lives. But really, about 70% of what a paramedic and EMT does out there on the ambulance is not sick, dead, and dying people. They're people that have healthcare navigation problems. They're people that are looking for the resources that all of us are working on. And so we've been developing strategies by taking those paramedics and EMTs, training them in similar competencies to the CHW, and expanding a little bit of their clinical scope and their understanding of that, to create another resource navigation piece out there in the community that helps those people when they're in crisis or after their crisis, to be able to get them back to those other resources that are out there in the community. All of the different social determinants of health, transportation, food, all those things. So we don't think of ourselves as a solution. We think of ourselves as a resource hub. We think of the 911 system as a big giant referral process for us, where we find those people, because the first thing that happens when someone needs something, are one of the first things when they can't figure out what to do, they call 911, right? So our paramedics and EMTs are out there in Twin Falls and Rhom, and kind of the surrounding areas, helping out, figuring out how we can connect people back to many of the organizations that y'all are working with, and just trying to do a better job of being more efficient in our healthcare systems and finding solutions for people. So I'm excited to answer some of your questions too, because it's all about rural stuff. And I love the rural healthcare setting. It's my favorite. Big cities, whatever. There's people everywhere. They'll help you. So that's my elevator pitch. So thank you for having me today. Appreciate it.
I love it. James, thank you so much for sharing your experience and your passion for rural health. We like that. And then we'll just have to wrap up kind of the introduction part of the panel. We'll turn the time over to Liz. And let me make sure. And James, I get to remove the spotlight from you. Sorry. And let's see, where are you, Liz? There you are. All right. Spotlight you. And oh, is it working for you guys? There we go. All right, Liz, I'll let you just give a.
Perfect. I'm Liz Behrend. I'm a disease intervention specialist with Southeastern Idaho Public Health. I saw that Renee is online as well. I know that she is one of our, I believe she's a DIS as well. She may be an epidemiologist. We kind of share roles sometimes. So Renee, I'm sorry if I misrolled you, but DIS, okay, perfect. So what I do, and it's different for every DIS in the different jurisdictions that we have. We're split up into 7 different jurisdictions in Idaho, and we all kind of wear different hats. I think that's a commonality for most community health workers. As I'm listening to all of you talk, we all kind of do what we can to help people, and that's why we're doing it. So that's fantastic. So the main portion of my job is to get sexually transmitted infections, HIV, and sometimes other communicable diseases as well. They get reported to us from the labs, and then we make sure that the patient is properly treated. If it's something like chlamydia is so rampant, we just make sure that they're treated. And not every jurisdiction can do that. We just have the ability in Southeastern Idaho to make sure that everyone's treated. And then with gonorrhea, syphilis, HIV, we make sure that we actually reach out to the person and make sure they're doing okay, because it can be kind of a big, scary thing to happen, even though it happens to anyone who is having sex. It can be scary for people. So we kind of try to give them the support that they need, get them in touch with different resources in the area if they're in need of something. Oftentimes these, especially syphilis and HIV, they're accompanied with things like drug use, they're housing insecure, things like that. So we really try to help them out and see what we can do for them. But we also try to help providers know what to do when they see those cases. So we try to make sure that everyone's treated properly, the providers know what to do for treatment, and then we do a lot of outreach. We offer free condoms to people in our area. So if any of you all need free condoms, you know where to go. And then we also, like, I do point of care testing in the jails. It's a really great program that we are lucky to have. We go to just the Bannock County Jail at the moment. We're trying to expand a bit, but we go and do free STI testing, and then they get free treatment as well. So it's no cost to the inmate, because when you are in jail, usually you don't have Medicaid, which is unfortunate. It's kind of stripped from you, which is very hard. You're being stripped of so many things, and then that's happening as well. But we also do a lot of outreach, try to spread some education, just trying to wear all those different hats and make sure everyone is taken care of to our best ability.
Awesome. Thank you so much, Liz. All right, and I know I see some questions coming through, and then we actually had a Google form that we had open before our event today that had some questions in it. For some of them were specific to an individual, and then some of them were kind of general. So I'm just gonna start with the question that was a general question from the Google form. And it is, what do wages look like in your respective fields? I want to commit to the CHW career path, but I want it to make sense financially. And it kind of goes into sustainability, like maybe a little bit of advocacy, like how can we advocate for that in different roles, things like that. So I'll kind of open it up, and you five can take whoever wants to speak up can just unmute and take that.
I think I'm still on the big screen, so I'll just talk a little bit. So I'll start it off. So our wages are kind of, this position was a position that we never had at our health department before. So our wage was a little bit based off of, before I was in this role, I was a COVID investigator. And that started at, I believe it was about $22 an hour. And every year you kind of get a little bit more based on how you work. And so I think that my wage was based more on what I was doing previously than what it is now. But I think that if it was coming up again, it would be around like 40,000 a year or so. I hope. It's hard.
So I started out a year ago. I make 25 something an hour, but I also make a little more an hour because I'm a certified medical interpreter as well. So I make a little bit more because of that.
I've seen recovery coaches bring in anywhere from $16 to $25 an hour. It's actually a billable services for agencies through Medicaid. And so there is, and we do tell people to really, advocate for, the problem is when your peers or clients do not show up, then you don't get paid with billable services. But there's also grants that were given out to like recovery centers and, for IDOC and for recovery coaches in the recovery centers that are like per hour positions, around $20 an hour.
This is a loaded question. So wages are hard, right? But we're all adults here, and so we shouldn't be afraid to talk about it. And I'm saying that to myself, not necessarily anybody directly. But at the end of the day, passion doesn't pay the bills, right? So I know for us here at Full Circle, it really just kind of depends on your experience. Obviously, being bilingual, of course, adds to your pay as well. Being a certified medical interpreter will add to that. But somebody just kind of coming in right at the gate, little to no experience, we kind of just we shoot for like that anywhere between kind of $18 to $20 mark and go up from there. And then, but the reality is that as community health workers, we're not a billable, right? I think just at the first of the year, Medicare passed the ability to start billing. So that's going to be a game changer for the profession. Usually once Medicare starts billing, not too terribly far behind that is going to be Medicaid. So we're kind of, we're working on that and what that's going to look like. And that's naturally going to, it's going to greater our opportunities for financial compensation, but get out there and advocate for the position, because I mean, on the back end of things, when you're doing the books, the amount of money that a CHW can save when it comes to patient care, just by doing what they're naturally good at, the numbers are there. We just have to advocate for it.
So in my world, EMTs could practice anywhere from full volunteer agencies where there's no payment at all and you're just putting back into your community, up to paid per call or paid per service. And those are our super rural entities, all the way up to some of the same pay ranges that y'all are talking about for community health workers. And then paramedics are paid a little bit more than that. So pitch for someone on the call, Miss Maria is one of my partners in crime, kind of. I know she won't admit it. But here in Twin, St. Luke's Health System, Family Health Services, our FQHC, and some other community partners are putting together a CCH. And we are currently looking for and hiring social community health workers to work in that entity. And she just texted me and told me that similar rates of what you all are talking about in that 16, 18, 20 and up range. So I hope that answers your question.
Thanks so much, guys. And then I'm gonna just keep moving through questions because we're getting a lot of them, so it's exciting. So this one is a question for Liz. What other credentials are required to be a DIS? And maybe just address like what the path might look like to do that.
Okay, this is kind of a hard question as well. I think it depends on your experience. So personally, I do not have a degree. I was a massage therapist before I was doing that. So I had like a 10-month learning course where I did that. But I did have my own business. So I think they kind of go off of what you've done. I know there's other people. For a while, the health department wasn't hiring people without degrees, but now that I know that they are more open because they miss a lot of lived experience, which we all love. So it's hard. You can go this very kind of standard route to get where I am or get into like an epidemiology position, which is like a step higher than I am in my eyes. But it depends. But anyway, you could get like a master's in public health. I know that that is how to be an epidemiologist, but I know that this specific position, it's just having the drive to do it and kind of knowing your community.
Awesome. Thanks, Liz. Okay, so and if you guys have follow-up questions, we'll make sure that we can get you guys in touch with these panelists as well for those that are listening. So another question for Debbie that came through the Q&A is you might work at one of the few organizations with a team of CHWs and a CHW supervisor with CHW experience. How might we advocate for more CHW supervisors with that CHW experience? And there's a similarly question, so I'm just going to tie that in. It says, similarly, how do CHWs who feel ready to supervise other CHWs let their management know that they're interested and are ready for that progression? Go for it, Debbie.
Gosh. Okay, so I want to make sure I understand. The first question was, how do we advocate for more leadership, essentially, for the CHWs and experienced leadership in the CHW field?
Yeah, that's how I understand it.
Okay. So I feel kind of spoiled answering this question personally, because when this role came up, they were specifically looking for someone that knew the role. I think, gosh, when I want to put in my logical brain, when you're looking to kind of to pitch that to upper management, I would, oh gosh, maybe Diane can kind of help me here too. I personally, I'd be keeping a record of interactions with clients, interactions with your community, things like that, that there were perfect examples of needing an active professional source of leadership that you can only get from a CHW or an advocate in general. That would be documentation, right? Again, because if we don't document it, then it's just our opinion and we know where that's going to go. So that would be my first go-to. Does that answer the question at all? Diane's, I can see her waiting. I know she's got something good.
Diane, you're welcome to pitch in if you have something to say.
Well, I think the more things that you participate in, you may not realize how they affect what you do as a community health worker. I worked in Oregon as a family support worker, and I did home visits with mothers and babies. And that was a great background for this. I worked for the Commission on Children and Families, and it was a child abuse prevention program. But everything I learned doing that just rolled into this. But if you're a scout leader, if you run a youth group or participate in a youth group in your church, if you're an Avon lady, if you're out there in your community and you're networking with people, you can be a CHW. You can learn from others once you get the job. You know, you can read the paperwork, the books, you can take the classes. The heart and the networking in your community matter.
I don't even think there's anything to add after that. Thanks, Diane. So awesome. Let's see. I want to just make sure we're addressing these questions. Okay, I already answered that one. Okay, and then this question is for Jennifer. How do you get SUDA or CADC certified for licensure in treating alcohol or drug dependency?
So it's a college degree, and Ryan Lindsay would be a great one to talk about that. The ISU has a program to get your CDAC. And what was the other question? The ISAS?
The SUDA or CADC certified. So
Oh, okay.
SUDA.
That's, you mean SUDA, okay.
Yeah, SUDA, sorry.
It's actually it's the first step of getting your license, drug and alcohol counseling license, is a SUDA. It's a student of addiction studies. And so it's basically college courses to get and it's a bachelor's degree now, so for CDAC.
Awesome. And I think, Ryan, are you putting an answer in that Q&A? Okay, perfect. And then this is a question for James. Based on your experience, what do you see as similarities and differences between community EMT and paramedics and CHWs? How can community EMS collaborate or partner with CHWs to reduce gaps in healthcare in rural Idaho?
Well, you're going to find that really the core competencies of the two, community EMTs and community health workers, are pretty similar. The community EMT has some of that advanced clinical knowledge, so they're able to kind of do assessments and some of that stuff. And then, like with the community paramedic, it's a lot of the community health worker, a little bit more, and then probably into like programmatic design and things like that for these community health programs. Now, how can we partner in the community, and especially in the rural communities? There's not very many of us in the rural community, right? So it's a great partnership when you can start working together, collaborating with those other agencies, the EMS agencies, the local clinic, the FQHC, the whatever it may be, the waitress at the pancake place, to start just collaborating and trying to figure out kind of what you can do in our super rural and remote areas. And I think I like in our community, we've already kind of partnered with some people around the community that are doing a lot of this community health worker work, like with Brianna, I believe, with a community care organization. We take that work and we use it as to kind of evaluate and see what's going on with the person, and then move them off to those community care programs with dementia and Alzheimer's. And I tell everybody in Idaho, yes, it can seem like a very resource poor state, and some of the studies and stuff suggest that, but I think there's a lot of great people that are willing to do the work, and it's just getting out in the community and connecting those pieces. So.
Awesome. Thanks, James. And then there's another question for any or all of you, if you each want to take a moment to talk about this. It says, for many CHWs and EMTs, there are entry-level jobs. What are some career pathways for CHWs or community EMTs? And I don't know who asked this question, but from what I understand, that's like, so once you enter, where you can go, possibly. Does that make sense to you guys? What are some career pathways for CHWs or community EMTs?
Since you brought up EMTs, I'll jump on it first. So really, as far as EMT and even into paramedic practice, we have to understand that EMT is your first basic level of practice. Well, EMR is actually, and that's just a short course, really good first aid, and some of those things. And then EMT, we can do it at the collegiate level actually, and it's about a semester. And then we have advanced EMTs, it's about 2 semesters, and then paramedic is associate's degree level or academic certificate over 4 semesters. Watch the clinicals, all that stuff. What the career field is actually really expanding. You can get into that work, and especially if you get into the community EMT work, I think there's a myriad of different paths you can go down. I'm excited to hear about the community health worker expansion and funding streams and all that piece. EMTs don't just, everybody thinks, well, they work on ambulances or they work on fire trucks. It's not true. They're kind of everywhere. They're in the industrial setting. Micron, large organizations hire EMTs for safety and response once you get some experience. There's management level positions. There's safety positions at lots of different organizations. There's working with my team. We do everything from going out resource coordination all the way up to we're building what's called a hospital at home program, where we're going to take care of people just like the inpatient setting in home. Don't ask any questions about that. I don't have enough time. And so we're kind of across the spectrum and with EMTs and paramedics, not only just running 911 calls, but moving people between hospitals. And I think really the sky's the limit right now. And I'm excited to see where the career field's going and all those opportunities starting to really open up.
Whoever wants to take it next can go ahead.
So the recovery coach training program, we really encourage everybody to take the community health worker training along with the recovery coach training. And what that is working with people in addiction with lived experience. And it's a 46-hour training. And then you have to do 500 hours of internship, practicum, working with people, clients. And then you can take your state test. So it's a certification that you have to kind of go through the process of the training and the internship, and then also getting state certified. And so it's a great program to, if maybe a starter program to get into addiction studies. So
I was just going to mention, I think a CHW course would probably be beneficial for anybody in the medical field, really. I know starting in 2025, all rural hospitals are going to have to start reporting on social determinants of health. So I've been on a couple focus group panels as well, just because so many places are having issues with their staff, nursing staff, having to ask those questions, the hard questions. Do you get enough to eat? What's your mental health status? How are you getting to the doctor? All of those. So, throwing in an extra course for them to be able, because now they have to report it. The federal government's making them. I mean, it should have been done a long time ago. We may not have gotten to the point where we're at with our healthcare and people's health, but that's just my opinion.
Okay, so my take on the question was that the CHW position is kind of an entry-level position. I'm a prime example of that. And if you don't necessarily take the CHW route, where can you kind of branch off to? Is that what I'm understanding?
I'm not sure who asked the question, but if someone wants to pipe in and clarify, they're welcome to. But I think that sounds great, Debbie, if you want to keep going with that.
Okay. All right, I'm gonna roll with it. So I think there's several different avenues that that an advocate can take. It's not just community health per se. Of course, we've got social work, right? That's right there at the tip top. I think there's case management, and it doesn't have to be necessarily for health specific. It can be drug and alcohol abuse. It could be domestic violence. It could be childhood behavioral health. That's another good avenue. And let's see, even just chronic care coordination. That, you know, it's kind of another branch, still working as an advocate. Occupational health is another one that comes to my mind. Vocational health, vocational rehab, project management, let's see, nonprofit management. That's another one. Yeah, so those are just kind of the few that come to the top of my head.
Okay, so my position isn't necessarily an entry level. I think like our CSRs, which is our, I forget what that is standing for, so I'm so sorry. But they are basically the front desk. They answer all the phone calls, they keep track of things by email, they check in people to the office. If you get a job like that at the health department, I think that you can really go anywhere, because once jobs become available, usually they become available internally before they become available externally, just because we know you when you're in the office. So I think that that is the best kind of entry level position. And once you get there, you can go anywhere you would like. There's so much that the health department does that people don't know about. We have like, oh, perfect. You put it in the chat. Thank you so much, Ryan. So you can go anywhere from environment to parents as teachers to a DIS, which is what I do. And also, if you want to be in a DIS role and you kind of want to move up from there, it's just getting trained in more things. Like I got trained on point of care testing, which is just the rapid testing that you do by a finger poke. And now I do think point of care testing. And if I get like phlebotomy certified, I could go and test people that way with their blood. So it's kind of endless what you can do. You just have to kind of have the drive to do it.
Awesome. I think everyone addressed that question right. Not missing anyone. Yeah. Right. So thank you guys for, we're supposed to be done at 3:30 for everyone. And I know we have an evaluation, right? We want to evaluation and then address questions after, or what would you
Yeah,
recommend?
Sarah, why don't you move put up the evaluation slide so people can do that. I just wanted to thank our, I wanted to thank our panelists. And I really just, my mind's been racing because I'm in the space of workforce development. I love Diane's last comment about, I never wanted this webinar to be about, you know, having CHWs feel pressured to move into other ranks. And so if you're, if you feel valued and happy in your space, maybe if you don't know if you're valued, but you feel happy in your space and want to stay there, just stay, it's okay to do that. There's a lot of discussions happening nationally about, maybe CHW should be like a something you put after your name in your list of certifications, and something you carry with you if you do go into other careers. Because for me, if I know somebody's been a CHW, that tells me a lot about a lot about their experiences, their lived experiences, and hopefully, likely, very likely, means that they have rapport in their community and have ability to connect with people and build those relationships of trust. And so, you know, that's an interesting thing that as you know, going to Calvin's comment, that you know, we do see, unfortunately, a lot of CHWs that for a variety of reasons have to move out of the profession, and that might be because of burnout in the profession. It can be daunting, the things that community health workers encounter as members of the community. Sometimes it's very close, and things they live every day as well, and that can necessitate a career change. There may be, you know, that they need to get paid a little bit at a little bit higher rate and move up a ladder. Maybe they're just interested in training and supervising. So lots of different reasons, and that's why we wanted to talk about, yeah, the opportunities to just be a lifelong learner with Jenni, move into supervisor roles with Debbie, and then talk about some additional certifications or career pathways with Liz and James. And my screen went away, and I'm forgetting Jennifer. So thank you for joining. If you have a moment to evaluate it, it really should be 2 minutes or less. We appreciate your time, and we look forward to seeing you at the next Mini-Learning Collaborative. Thanks, everyone.
Yeah, and I was going to say, while some of you are doing the evaluations, we just had one last question come through, and it's for those agencies and clinics that don't have CHWs or CEMTs, what would you say to them about why they should invest in hiring CHWs? And I know we've kind of talked about that a little bit, but if anyone wants to add or pitch in, like, what value, you know, what would you say to an agency or clinic that's considering about bringing on a CHW or a community EMT? That would be awesome if we can end on that note.
There is, and I'm completely drawing a blank right now, but if whoever that is drops their email, if they're comfortable with it, they can just send me their email address. I have a document about the return of investment on a CHW. You know, again, because passion doesn't pay the bills, right? And if you don't have data, then you just have your opinion, and we all know where that goes. But that'd be my biggest thing, is to just start looking into the return of investment on a CHW or an advocate of any sort. I mean, there's studies in there that you pay a CHW $10 and they're going to save you $100. So
awesome. I was gonna say, Debbie, in fact, all of the panelists, if you can just drop your information in the chat too, that would be helpful. So if anyone wants to reach out to you, they can. And Debbie, if you want to like send that to me, I can maybe send it out to the participants today. Yeah, along with the recording of the
absolutely.
meeting. That would be great. Awesome. Anyways, I just wanted to address that last question because it was the one that came up. So thanks.
Thanks again for having me, Brian, Sarah.
Yeah,
Always
of
great to see you
course.
too.
Thank you.
Thanks so
I
much.
know.